On today's Two on Your Side Town Hall, vaccinating SUNY students. The chancellor of the state university system will join us live to talk about this big effort that will really impact all of us, not just students or their parents. We'll explain how.
Plus, the pandemic caused us to miss so many events around the world in the last year. But what about shows that were just postponed and not canceled? We're looking at whether certain tickets are eligible for refunds.
And Georgia has been in the news lately due to changes to election laws. But one of the country's most powerful politicians brought New York State into the conversation. An election law expert will join us to talk about that.
But first up today, now that all New Yorkers 16 and older are eligible to get the coronavirus vaccine, there will be an increasing effort to convince young people to get the shot.
Yeah, that's because, as we reported earlier this week, new polling shows 18 to 24-year-olds are the most hesitant vaccine group, most hesitant to getting it. Maybe that's because statistically they're less likely to get severely sick, but remember there are exceptions to that. And also remember, young people are important to reaching herd immunity, which is what will end this pandemic.
To help with the vaccination effort, the SUNY system is starting a new program to vaccinate students who live on campus with the single-dose Johnson & Johnson shot. Yeah, there are already more than 18,000 doses available to be part of this program. More to come. The goal is over the next several weeks to get as many as possible immunized before these students leave campus to go on summer break. And joining us live right now to talk about this and more is Dr. Jim Malatras, the 14th chancellor of the SUNY system. It is great to have you back on the show. Thanks for your time.
It's great to be here. Thank you.
And first, we want to know more about how this vaccination effort is going to work across the SUNY system, and how many doses of the J&J vaccine do you think you'll be able to get total over the next few weeks, specifically for SUNY students?
Well, first, thanks for having me on. What we're hearing from our students is not hesitancy. They have been urging us to get them eligible for this vaccine because they want to go back to normal. So if anything, our SUNY students are like, just get us this vaccine, put it in our arm, and let us turn the page. The state came through in a big way for us. They provided about 19,000 doses of the J&J vaccine, so our students can start getting the one shot before they go home, so they come back in a month or so. So that's a big deal. We hope to get more doses throughout the course of the next couple of weeks. But at the same time, we have nearly half of our SUNY campuses already open to the general public, which our students are now eligible for. So there's many opportunities for our students to get inoculated so we can turn the page on COVID.
Yeah, it really does lead perfectly into our next question here. SUNY has done a lot to help New York State. Early on, it was in terms of testing, and now, as you mentioned, it's in terms of, vaccinations. You have this program specifically for your students on campus, but SUNY campuses have hosted these vaccine clinics. At last check, I think 900,000 doses have been administered on SUNY campuses. I want to share part of a story that we got this week from Stony Brook. Listen to this.
Stony Brook is hoping to vaccinate 8,000 students in the next 30 days.
No one could be prouder of a moment like this when we see, kind of the brighter days ahead.
For this university, those brighter days mean more in-person learning. Right now, only 20% of classes are in person. Come fall, that number will rise to 80%.
Learning in a completely different experience, so hearing that is really relieving.
One remaining unknown for next fall is whether the vaccine will be mandatory for all students. A SUNY spokesperson told me that has yet to be decided, but for today at least, the students indicated a vaccine mandate wouldn't bother them.
And they said, hey, you should get this, you should do this, and I said, okay, I'm ready to go.
I said, okay, I'm ready to go, is what that young man said. When will SUNY decide if a vaccine will be mandatory for those who return to campus in person? And how much of a difference will it make when you get a big portion vaccinated and you can go back to some type of normalcy?
I think our students said it best. Okay, let's go. We're ready. I think they want to get the vaccine. Our best ambassadors right now is not the chancellor of the State University of New York. It is our students. We have now done a huge social media campaign. We are sending out emails from our students. We are doing it in 11 different languages. We're giving them all of the facts. We think we're going to be able to get most of our students vaccinated without a mandatory vaccine program. But we'll cross that bridge if we get to it. By the summertime, if we feel like there's not enough students getting vaccinated, We'll talk to our board of trustees, we'll talk to our campus leadership, and we'll talk about potentially doing a mandatory vaccine program. But right now, what our students are saying is, you don't have to mandate it. Just give us the flexibility, the schedule, the time to come in and get vaccinated, and we'll do it. So I think we're all in, and our best ambassadors right now are our students. So let's get going. I mean, our student has the right way. They are ready to do this. They just want the facts, they want the time, and I think that's where we are right now. I think our students want to do this voluntarily.
Even with the numbers saying that there is some hesitancy between 18 and 24-year-olds. As you were saying, the SUNY students seem to have great buy-in with this. You're getting them to help other students as far as getting the word about getting the vaccine. What is their message to the other students about the importance of getting the vaccine?
Our SUNY students have been heroes from the beginning. If you think about what our SUNY students have done, they are getting mandatory testing every week. We're close to 1.8 million tests since the beginning of this fall semester. They're getting tested. They are subject to protocols of masking and other things. Our positivity rate on our campuses is below 0.5%, which is much lower than the statewide average. They're doing everything right. So this is just another step in that whole process of they want this to be over. So if the vaccine can turn the page on COVID, if we go back to more normalcy through the vaccine, they're going to do it. So the more we can do social media, the more we can do a public awareness campaign using our students as ambassadors, that's what's going to make this happen. No mandatory thing is going to get it done. It's going to be our students convincing other students who may be hesitant. This is the right thing to do because this helps the larger society, not just our campuses.
Dr. Malatras, we're almost out of time, but before we let you go, I want to know, the state legislature, the governor agreed on a budget. This just happened over the past couple of days. For students watching and probably more likely their parents watching or taxpayers watching right now, what should they know about how this new state budget impacts SUNY?
The state legislature and the governor have invested in the State University of New York, which we really appreciate. They added money to our tuition assistance program, which really helps our students. They've expanded our opportunity programs, which allows underrepresented communities to go to college to begin with and live the American dream by going to college. There's a lot of good in this budget. So we thank the governor, we thank the state legislature, the assembly and Senate for really coming through for us in the budget this year.
Dr. Jim Malatras, the chancellor of SUNY, has been our guest. Thanks for coming back on the show. We appreciate it.
Thanks for having me.
Yep, great to see you. All right, we've been getting a lot of viewer questions recently about a phrase that we've heard about since almost the beginning of the pandemic, herd immunity. That is, of course, the point when enough of the population is immune to the virus that the risk of any spread gets incredibly low.
So now that more people are vaccinated and death rates seem to be coming down, is the U.S. getting close to reaching herd immunity? Well, here's what CDC Director Dr. Rochelle Walensky and Chief White House Medical Advisor Dr. Anthony Fauci said about that idea today.
I'm really encouraged by these decreased numbers of deaths that I believe to be an impact of vaccination, especially the vaccination of our elderly communities. But I think we're way too high to be thinking that we've won this race.
We'll know it when we see it. It'll be obvious as the numbers come down rather dramatically. And when they do, we're going to wind up getting really stepwise, much more towards what we consider approaching a degree of normality, which everyone really quite dramatically notices it. It's on the way. Hang in there.
Those words "hang in there" really say a lot, don't they? The short answer here is no. Infectious disease experts say we have not reached herd immunity yet.
Yeah, but they're optimistic that we are inching closer toward it. Vaccine distribution has picked up so much recently. I think it's hard to give people a date, right? Like, it's not like it's, July 24th, we're going to reach herd immunity. That's not really how it works. But I think when you look at those charts every day that we show people, infection rates and all that, when you see it really start dramatically going down, you'll know that we've hit sort of this tipping point.
Yeah, interesting to hear too. You'll know it when you see it.
That's right.